Oh, nope, hold on.
If I was going to give an injection, I would come into my patient's room and I would introduce myself and I would say, "Hi, my name is Francesca Couser, I'm a senior nursing student," and I would check the physician's orders to make sure what kind of injection I was giving, what solution it was, and where the site was located at. So I'd come in the room and check the bed breaks. I would ID my patient using 2 patient identifiers. I would look at their name band and I would ask them their name and date of birth. After that, I would then go and I would wash my hands and I would gather all my supplies and have and place gloves on my hands. And I would also provide privacy for the patient by pulling the curtain. So the first injection I'm going to give is an intradermal injection, and the needle gauge for this is 26 to 27, and the needle length is 1/4 to 1/2 inch, and it's given at an angle of 5 to 15 degrees, and you do not aspirate. And so I would take it and I would draw up no more than 0.1 mils, and I would stretch the skin of the inner forearm. I would inject, pull out, and sharps. And that's generally done on the inner forearm or the upper back. And so the second injection I'm going to give is a sub-Q injection. And sub-Q, the needle gauge is 25 to 27, the length is 3/8 to 5/8. And you do not aspirate, and you determine whether or not you go in at a 90 or a 40 degree angle by whether or not you can pinch an inch. So if you can pinch an inch, you go in at 90 degrees. Pinch 2 inches, you go in at 90. If you can only pinch 1, you go in at 40. So we're going to pretend I can pinch 2 inches. So I would pinch the skin, stab, inject, pull out, sharps. And I would give no more than 1 milliliter for this injection. And the sites are usually the anterior thigh, the abdomen, the subscapular region, and then the upper outer arm. The next injection I'm going to give is a deltoid injection. And for a deltoid injection, the gauge is 21 to 23, and the angle is 90, and the needle length is 1 to 1.5. And so I would take and go 2 finger widths below the acromial process, and then I'm going to do the same thing. I'm going to stretch the skin, stab, inject no more than 1 milliliter, pull out, and sharps. And for this you don't aspirate. Okay? And then the next one I'm going to give is the ventral gluteal. And for this one, I'm going to place my hand on the greater trochanter with my finger going towards the ASIS. And I'm going to pick a spot and pick a landmark, and then I would swab with my alcohol. And my gauge needle would be 21 to 23, and the length would be 1.5 to 2, and I would give no more than 3 milliliters. And I would then stretch the skin, stab, inject, pull out, and I would have aspirated on that one. So then, for the last one I'm going to give is the vastus lateralis, and for this I place my hand above the knee and below the greater trochanter, and I form this, and then I'm going to find a landmark, so I'm going to go right here, I'm going to swab, I'm going to once again draw up no more than 3 milliliters, and the needle length will be 1.5 to 2. I'm going to stretch the skin, stab, aspirate again, inject, pull out, and sharps. And I could also use a cotton ball to put it over the site if they're bleeding a little bit, and I would just clean up all of my supplies, and I would make sure the patient asked them if there's anything I can do for them, and I would just make sure to check the site for signs of irritation. And other than that, just make sure the bed is in lowest position when I walk out of the room, discard my supplies and wash my hands, and that will be it.